Well, hey everyone, welcome back. Glad to have you here. Today we're gonna dig into something. Well, it's not the most, shall we say, glamorous
Yeah, it's
topic.
definitely not one you want to bring up over dinner.
Exactly. But
Yeah.
super common, and once you get past the whole, ick factor, honestly, kind of fascinating.
Yeah, I'd agree with that.
So today's deep dive, get ready, it is oral thrush. We're going to figure out exactly what it is, how to spot it if it's happening, all that good stuff.
Your mouth can actually tell you a lot about what's going on in the rest of your body.
That's kind of what I gathered reading through all this research you sent over. Okay,
Well,
so first things first. Oral thrush. What are we even talking about here? It's like a yeast infection, right? But in your mouth.
yeah, exactly. You got it.
Huh?
Basically, it's this overgrowth of a specific type of fungus,
And that fungus is called?
Candy albicans.
Candida albicans. Right, okay. It's
Yeah.
all coming back to me now.
Now, the thing is, everyone has a little bit of Candida hanging out in their mouth naturally. It's totally normal. But when it starts to, like, multiply out of control,
Like weeds in a garden, as they say.
that's a great way to put it. That's when it becomes a problem, and that's when we get oral thrush.
So not some super rare thing?
Nope, very common, actually.
Good to know, good to know. Okay, so you think you might have this Candida party happening in your mouth. How can you tell? The articles mention something about, like, white spots.
Yeah, white spots, often with a kind of cottage cheese-like appearance.
Oh, okay. See, now I'm just imagining myself mistaking that for, like, leftover food or something.
Happens to the best of us. But yeah, if you see those white patches, it could definitely be oral thrush. And it makes sense if you think about it. You know, those Candida cells, they're like tiny little mushrooms.
Huh? Never thought of it. Like,
When they multiply like crazy, they create these raised, kind of clumpy patches.
interesting. Okay, so that's what to look for. But what about other symptoms? The articles you sent mentioned burning sensations, even changes in how things taste.
Right, it's not always just visual. And that's because all those extra Candida cells are irritating your mouth, making it dry, sometimes even painful.
Uh, okay. Not fun. So we know what it looks like. We know how it feels. Why does this even happen? Please tell me it's more complicated than just, forgetting to brush a couple times.
It definitely is. Although, yes, good oral hygiene is always important, of course. But one of the biggest culprits might surprise you. Antibiotics.
Really? Antibiotics?
Yep. I mean, we know they're great for fighting bacterial infections. But as one of your articles mentioned, Dr. Agrawal, I think, they can sometimes be a little too good at their job.
How so?
They can end up killing off the good bacteria in your mouth along with the bad, and that throws the whole ecosystem out of whack.
Ah, so it's kind of like what we hear about the gut microbiome.
Exactly. Your mouth has its own microbiome, too. All these microorganisms, bacteria, fungi, all coexisting. And when antibiotics disrupt that balance,
Candida's like party time.
exactly, it's the perfect opportunity for it to take over.
Wow. So even when we're trying to be healthy, taking our meds, it can have these unexpected consequences. Wild. Okay, so antibiotics. Got it. What else? I know dry mouth came up a lot in the research.
Right, and there's a good reason for that. Saliva is super important for keeping Candida in check. It's got all these natural antifungal properties.
Ah, so when your mouth is dry?
It's like losing one of your best defenses.
Okay, suddenly chugging my water bottle feels very important. But seriously, it makes you think about how all these things we might not even think about, diet, stress, all of it, can affect that balance in our mouths.
Yeah, absolutely.
So to wrap things up, oral thrush, pretty common and usually not a huge deal health-wise, but you definitely want to be able to spot it and get it checked out if you need to.
Exactly. And, as you keep learning about all this, here's something else to think about. If something like oral thrush can be a sign of a microbial imbalance, what other factors in your life, your diet, your stress levels, what else could be playing a role?
Whoa, good question. It really makes you stop and think. Okay, everyone, that is a wrap on our deep dive into the world of oral thrush. Thank you, as always, for lending us your expertise on this.
Of course, glad to be here.
And to all of you listening, thanks for exploring with us. Keep those brains buzzing, and we'll catch you in the next one.